Did you know that your cat might be dealing with a silent illness and you haven't even noticed? Is it drinking more water? Losing weight for no reason? Ignoring these signs could be dangerous. Diabetes in cats is more common than you think, and it could change your pet's life forever, but don't worry. With the right information, you can help your cat live longer and better. Stick around to the end and find out everything about this disease, how to spot the signs, and what you can do to protect your feline friend. Ready? Feline diabetes is a chronic disease that affects the body's ability to regulate blood glucose levels. This happens due to issues with insulin production or function, a hormone crucial for cells to absorb glucose. When this process fails, glucose builds up in the bloodstream, causing various symptoms and complications for the cat. This condition is progressive and can severely impact the animal's health. There are two main types of diabetes that can affect cats. Type 1 is rare and occurs when the immune system destroys the insulin-producing cells, making the animal completely dependent on hormone replacement. Type 2, which is more common in cats, is associated with insulin resistance, making it harder for the hormone to function. This type of diabetes is often linked to factors like obesity and lack of exercise. Many pet owners are unaware of this condition and often take too long to notice the signs. Since type 2 diabetes develops slowly, the symptoms can be subtle at first. However, if left untreated, it can lead to serious complications, including organ damage and even life-threatening conditions. That's why it's essential to understand the causes and risk factors of the disease to act early. The good news is that with a quick diagnosis and proper treatment, diabetes in cats can be managed. In some cases, it's even possible to reverse the condition with changes in diet and lifestyle. Let's dive deeper into the factors that contribute to the disease and how to prevent it. Feline diabetes doesn't have a single defined cause, but there are factors that significantly increase the risk of the disease. Among them, obesity is the main culprit. Overweight cats have higher insulin resistance, making it harder to regulate glucose. This happens because excess body fat directly interferes with the hormone's action. In addition to obesity, old age is also a major factor. Older cats have a slower metabolism and are more prone to developing insulin resistance. The risk increases especially after the age of 7, when the animal's body doesn't respond as well to hormonal signals. Keeping a close eye on their diet and encouraging physical activity from an early age can help prevent this problem. Another relevant factor is the use of medications like corticosteroids, which can interfere with glucose metabolism. These drugs are commonly used to treat inflammation and allergies, but prolonged use can predispose the cat to diabetes. The pet owner should always follow the vet's guidance and avoid self-medication to prevent such complications. Hormonal issues like chronic pancreatitis and hyperadrenocorticism can also trigger the disease. The pancreas is the organ responsible for insulin production, and any prolonged inflammation can affect its function. Hyperadrenocorticism, which causes increased cortisol production, can also contribute to insulin resistance. Factors like lack of exercise and poor diet only worsen these risks, making a healthy lifestyle essential for the cat. The symptoms of diabetes in cats can be subtle at first, but become more noticeable as the disease progresses. One of the first signs is unexplained weight loss, even if the cat is still eating normally. This happens because, without enough insulin, the body can't use glucose for energy and starts burning fat and muscle. Another classic symptom is increased thirst and urination. Since the excess glucose in the blood can't be absorbed by the cells, it gets eliminated by the kidneys through urine, pulling a lot of water with it. This causes the cat to urinate more than usual and consequently feel more thirsty to compensate for the fluid loss. This dehydration cycle can lead to other health complications. Besides these physical changes, the cat's behavior can also be affected. Many cats become tired, lethargic, or even aggressive, as the lack of energy affects their well-being. If the cat starts sleeping more than usual, avoids interactions, or seems weak, it might be a red flag for diabetes. The pet owner should be vigilant for these signs and consult a vet if they notice any changes. The sooner diabetes is diagnosed, the better the chances of managing it and preventing serious complications. In the next chapter, we'll look at how the diagnosis is made and what treatments are available. Feline diabetes is diagnosed through laboratory tests and a clinical evaluation of the cat. The vet typically requests a blood and urine test to check glucose levels. In some cases, more detailed monitoring may be required to rule out other diseases with similar symptoms. Once diagnosed, diabetes requires continuous treatment. The main aspect of treatment is insulin administration, typically through subcutaneous injections twice a day. While many pet owners fear giving insulin, the process is straightforward, and the vet can teach the correct technique to avoid discomfort for the cat. Diet is also a crucial factor in managing diabetes. The cat should eat a high-protein, low-carb diet, avoiding regular food that contains high sugar levels. There are specialized diabetic cat foods that help keep blood sugar levels stable. Additionally, meals should be served at regular intervals to prevent glucose spikes. Another important factor is encouraging regular physical activity. Diabetic cats need to stay active to help regulate glucose and prevent weight gain. Interactive. Toys, scratching posts, and daily playtime are great tools to ensure the cat exercises in a healthy way. If diabetes in cats is not properly treated, it can lead to serious complications. One of the main risks is diabetic ketoacidosis, an emergency condition caused by the buildup of acidic substances in the blood. This condition can be fatal if not treated in time, requiring hospitalization and intensive care. In addition to ketoacidosis, diabetes can cause damage to vital organs such as the kidneys, liver, and eyes. Prolonged hyperglycemia damages blood circulation, increasing the risk of infections and neurological problems. Many untreated diabetic cats end up developing motor difficulties, like weakness in their back legs. The best way to avoid these issues is to prevent diabetes before it develops. Maintaining a healthy weight, providing a balanced diet, and encouraging exercise are key steps. Regular vet checkups also help detect early changes and start treatment before the disease progresses. With proper care, diabetic cats can live many years with a good quality of life. The key to success is the owner's dedication to following the treatment and ensuring a healthy environment for the pet. If you notice any warning signs, take your cat to the vet as soon as possible. If this video helped you, leave a like so more pet owners can access this info. Comment below if you've experienced this with your cat or if you have any questions. And of course, subscribe to the channel so you don't miss more content like this. And don't stop here, we've got another amazing video waiting for you in the card and the description. Click now and keep learning. See you there.